Good afternoon, everyone. I hope everyone is feeling well today. I'm also fine, thank you. My name is Mangabonga Mhluli. I'm a dietetic intern at UKZN. Just to explain what a dietitian is someone whom you can trust when it comes to healthy eating because they are very well educated with regards to nutrition as a building block of life. So that is what I'm training to become. Okay, so today I'm here to talk about diarrhea in children. And by the end of this talk, I wish all of us would have gotten a better understanding of what diarrhea is and why it should be treated as a medical emergency, as well as how you can manage diarrhea at home. Okay, just to start by defining what diarrhea is, it is the passage of greater than 3 loose stools per day. There's a lot of causes of diarrhea, namely food poisoning or drinking water that is contaminated by a bacteria or lactose intolerance. So food poisoning is caused by eating food that is past its sell-by date or expiry date. Lactose intolerance can only be diagnosed by the doctor, but it means that your child is not tolerant to milk and other dairy products. Okay, so let us now get a better understanding of how a normal stool should look like in your child. So for breastfed babies who are less than 6 months old, a normal stool is one that is mustard yellow, green or brown, and seedy and pasty in texture. But for greater than 6 months old children, I'd like us to look at what we call the Bristol stool chart. Okay, so for a normal stool, this is what you should expect. It should look like a sausage, which is well formed. But when your child is experiencing diarrhea, you can get a stool which is like this. This shows that your child is not digesting the food properly. And you can also get a stool that looks like this, watery. And this stool should be passed for greater than 3 times per day. Okay. So why should diarrhea be treated as a medical emergency? Diarrhea should be treated as a medical emergency because it leads to dehydration, it leads to shock, and it also leads to weight loss if it persists over a long period of time. And also, diarrhea accounts for 19% of deaths in South Africa. So that is why diarrhea is actually serious. Okay. So as I mentioned, one of the leading consequences of diarrhea is dehydration. There are ways in which you can identify and tell if your child is dehydrated. You can tell if your child is dehydrated by them having sunken eyes or them looking tired. There's a lack of crying and energy and irritability, and there's also a sunken fontanelle, and also there's dry lips and a poor skin turgor. How you can determine a skin turgor is by pinching your child, and when you release your hand, it takes a long time for the skin to go back to normal. And also you can tell that your child is dehydrated by them feeding poorly or not wanting food at all after episodes of diarrhea. Okay, so if you notice any of these signs, please take your child to the clinic as soon as possible. And also, if you notice blood in your child's stool, please take them to the clinic as soon as possible. Okay. So the good news is diarrhea can be managed at home. It only depends on the severity, but you do not have to wait until you get to the clinic for you to manage your child's diarrhea at home. Okay. So the first thing is you must continue feeding. There's a myth that goes on that says when your child has diarrhea, you should stop feeding because it leads to it actually worsens the diarrhea. That is actually false. Continuing feeding is very essential during diarrhea because when your child passes those loose stools, nutrients are lost and electrolytes are lost. So when you continue feeding, you try to replace those nutrients that get lost. Okay. So another way in which you must manage diarrhea is you must give a sugar and salt solution, otherwise known as ORS. So how you give ORS is you give it after each loose stool while you continue to feed. ORS is very easy to make. It only takes 3 ingredients, namely water, which is 1 liter, boiled and cooled, 8 level teaspoons of sugar, as well as 1/2 teaspoon of salt. Okay, make sure to use the exact amounts of the sugar and the salt, because if you give too much sugar, that can worsen the diarrhea. Okay, so how you give an ORS is after each loose stool. For children who are less than 2 years old, you must give half a cup of the ORS, and for children who are between 2 and 5 years old, you must give 1 cup of the ORS after each loose stool while you continue to feed. If your child vomits, you must wait 10 minutes and then continue to feed and give the ORS, but more slowly. There are foods to avoid during diarrhea because they worsen the diarrhea, but it doesn't mean that you must stop all foods. Foods to avoid are orange and lemon because they may irritate your child's stomach. And also fruit juice. Avoid fruit juice because the sugar in the fruit juice may irritate your child's stomach. And also avoid fatty foods and foods that are high in fiber, such as whole wheat, seeds, and skins of fruit. But make sure to give foods that have soluble fiber, such as oats and banana, because those actually help with absorbing water that is in your child's colon to bulk the stool and try to decrease the water that is lost through diarrhea. Okay. And also you can give amahewu. That is also good for rehydration. Okay, so if there are any questions, please feel free to ask me, and thank you so much for your time.